Dr. Atul Kamath has come. I think Dr. Atul Kamath will be presenting on status post-exenteration in mucormycosis, death, disability, and depression. Over to you, Atul.
Good morning, everybody. I would like to apologize for coming slightly late for this thing. So my topic is status post-exenteration in mucormycosis, death, disability, and depression. So the aim of our study was to know the status of the patients who underwent post-exenteration after orbital mucormycosis. So as we all know, after the second wave of COVID-19, there was a outbreak of mucormycosis and especially orbital mucormycosis, following which it was most of the patients underwent some sort of orbital exenteration and some amount of ICU admissions for the same. So what we did was around 47 patients who were confirmed with orbital mucormycosis and underwent exenteration for the same were followed up for a period of over 1 year. And the cause of death, if it occurred, was noted and analyzed. And the people who survived, the patients, they all underwent Hamilton Depression Score for depression and social anxiety appearance test for their exenteration procedure. So out of the results that we found out, around 89%, that is 42 of them either expired within the first month of exenteration surgery. And the most common cause was being either the CNS extension of the mucormycosis, which was seen in around 29 patients, and the second being unrelated medical conditions like uncontrolled diabetes mellitus, which was around 13 patients. So the 6 people who survived, 2 developed moderate depression and 4 had severe depression with the Hamilton Depression Score test which it did. Excuse me. And all 8 of them had severe social anxiety. So the discussion, there's only one study which says that there was significantly higher levels of anxiety and depression post-exenteration of the orbit. And 3 months post-exenteration was what they did on a follow-up. We did it after 1 month of the follow-up of the surgery of exenteration. So conclusion, the second wave had created a lot of havoc and many developed mucormycosis, for which destructive procedures like exenteration was done. Along with the high mortality following the surgery, post-surgical depression and anxiety levels were very high, and this needs to be tackled at the earliest to prevent any suicidal tendencies among them. References, thank you so much.
Thank you for that very interesting presentation. So this Hamilton score, is it a validated scoring system?
Yes, ma'am. So we took the reference from the psychiatry department, and they given us a score sheet. Based on the questionnaire, we have to tick the questions, and with that we'll get a score, and based on that grading, we can grade them into mild, moderate, and severe depression, ma'am.
Okay,
it's a question of around 20 questions.
Is it available free of cost, or
yes, ma'am, it's available online.
It?
We can download it. It's available online. The questions which are available, you have to just ask them and go on ticking the questions.
You did not show the questionnaire as such. You should have shown the questionnaire, you know.
Okay.
All right. So only very few patients were left for the evaluation.
Yes, ma'am, because most of them were either very severe and were in the ICU, so they couldn't make it following the exenteration. Because exenteration was done usually at the end stage when we weren't able to, so the patient was very severe, and just to have a last minute thing, we used to do the exenteration part. So after the exenteration, most of them would go to the ICU. And those who survived were only around 7 or 8 patients in whom we could do this particular scaling. Rest of them were either too debilitated or intubated, where we couldn't take the questionnaire out of them. And most of them lost their lives because of the severity of the mucormycosis.
But this was post-exenteration, no evaluation?
Yes, ma'am. So the people who survived after the exenteration was also very minimal, ma'am. So hardly 7 to 8 patients.
All right.
Was the patients was given any psychiatric medications post-exenteration?
The 2 or 3 patients were started on psychiatric medications. So who had severe depression were immediately started on psychiatric medications, and currently they are doing well, sir.
They're doing.
Yes,
so you mean to say that post-exenteration, the psychiatric evaluation is very important?
Very important.
Definitely, yes. The psychiatric patient. That's what we normally insist on, avoiding the exenteration for the mucormycosis until and until it is indicated.
Yes, and most of all because of the removal of the eye, they had this social anxiety as well.
Good.
Which because of which they led to.
Yes. Nice, fine presentation.
Thank you so much. Ma'am, it was around 50 to 70 years age group, most of them who made it.
Yeah, good presentation. Just this scoring system was done how many days after exenteration?
Post exenteration.
How many days post?
1 month, ma'am. Because after they survived and they came out of the ICU is what we could do it. ICU we couldn't do it.
Yeah.
Because they had to see their face coming out,
No,
and
they
only then.
went home and then took the depression score, because no in-house hospital can grossly affect the scoring system.
After they were discharged, after 2 or 3 weeks, they were called back and then we did.
Thank you.